That's exciting.
All right, good morning. This is May 30th and Senate Health and Welfare Committee. That we're looking at two resolutions this morning. The first one related to healthcare, and Jen, I think you have it. We can put it up on the screen.
Great. Good morning, Jen Harvey, Office of Legislative Counsel. Here is the most recent version we had looked at. I think this is draft 3.2. And this was looking at the some various actions that have occurred at the federal level. Title is Senate Resolution Opposing Recent Federal Actions That Threaten Public Health and Urging Their Swift Reversal. And we had a teacher.
Yeah.
We had gone through and added some references to Vermont. I think there were we've moved a few of them because we weren't actually sure what their effect was in Vermont. Like what the impact would be of the cut in federal grants for mental health services in schools. And so this is, I think, the most current version. Okay. So I don't know where you are.
Can we walk through each of the whereas briefly?
Sure.
As what they are, and then I think we'll just either decide if we're at a time.
Well, it'll be ready for next session, right? If we don't,
You will likely want to update the
yeah, sure, yeah.
update to reflect more recent events. Or at a minimum, not describing them as recent federal actions in this case. So this talks about on January 20th, 2025, President Trump issued an executive order to withdraw the U.S. from the World Health Organization, a move that jeopardizes the health and well-being of Vermonters, other Americans, and individuals all around the world, because the WHO is focused on improving public health and on detecting, preventing, and responding to health emergencies, including disease outbreaks that do not respect state lines or international borders. And whereas the U.S. Department of Health and Human Services is eliminating the jobs of approximately 20,000 employees, including Centers for Disease Control and Prevention, where teams were cut, whose work focused on preventing injuries and violence from causes, including, and then we talked about whether you wanted to make changes, but I don't think you made any decisions.
I think we just send it. I think I have edited my own copy, but I'm not stuck on this, but I think I crossed off. So focus on preventing injuries and violence from causes including motor vehicle crashes, child maltreatment. And then I think I crossed off falls in the elderly and
Yes.
just did child maltreatment
Traumatic brain
and
injury.
traumatic brain injury. I think I crossed off drowning.
We took drowning and
I'm
falls.
actually going to put this back up as the Word document so I can edit it while we're here.
Okay. So, yeah, falls and drowning were out,
Okay.
but we had fun about that. Okay, good.
All right, so let me take out. So what did you want to falls and drowning out?
Falls and drowning
So
were out.
the child maltreatment and traumatic brain injury. Semicolon.
Yep. All right.
Okay, that one
On tracking transmental health and substance use disorders, on rape prevention and education, on maternal mortality and maternal and child health, and on many other areas affecting public health in Vermont, the United States, and beyond. Whereas the Trump administration has eliminated the entire management and regulations divisions at the Center for Tobacco Products in the Food and Drug Administration and cut most of the staff at the Office on Smoking and Health at the CDC, which severely hampers tobacco regulation and enforcement efforts and will have and I think we changed from devastating to negative impact on tobacco prevention in Vermont's youth and on Vermonters' public health.
yes.
And whereas the National Institutes of Health, as part of the U.S. Department of Health and Human Services, that describes itself as the nation's medical research agency, making important discoveries that improve health and save lives, is now refusing to award grant funds to universities that operate any programs that advance or promote diversity, equity, and inclusion, which jeopardizes the future of medical research and disregards the existence of health inequities. And whereas the U.S. Department of Education cut approximately $1 billion in federal grants that support critical mental health services in schools, which will dramatically reduce access to these services and threatens the health and well-being of youth around the country. And then you were reconsidering what you want to say here, but whereas the Secretary of the U.S. Department of Health and Human Services lacks understanding of science and scientific research, oh, maybe you put in the Secretary specific,
Yeah,
including peer-reviewed research regarding vaccines and autism. Now therefore be it resolved that the Senate of the State of Vermont stands in support of science, opposes these federal actions, and urges their swift reversal.
can I just ask?
Can I say? Oh, on that last whereas,
Go ahead.
whereas it appears the Secretary of the U.S. Department of Health and Human Services lacks.
Ah,
I was
I-
gonna say, because do we know for sure he lacks understanding or he just denies?
It appears.
no, that's great.
Yeah,
That is great.
it does appear.
It does appear, does it not?
I think that's a great revision. And be it further resolved that the Secretary of the Senate be directed to send a copy of this resolution to President Donald J. Trump, Secretary of Health and Human Services, Robert F. Kennedy Jr., and the Vermont congressional delegation.
Okay. All right.
Nice. I mean, it could be like 10 pages long, but we'll just leave it at this.
I think we've hit the high point, the science piece,
Yeah,
the prevention piece.
Yeah.
And
wait, oops, sorry. What? I don't remember, or I wasn't paying attention. What's in there for vaccines? Because I keep hearing about,
he's canceled vaccine, COVID vaccine.
is there anything in here about?
I think some of those most recent actions have been more recent than
Yeah,
Yeah,
that's.
okay.
So there's some
Do we
things
not,
that you want to
I
say.
just,
well,
I keep hearing that. these-
disease outbreaks, emergencies at the WHO level.
Okay.
Yeah, I mean, we can't do everything. We've got.
No, I
we could
know.
Say, where would we put that in the
Although it is
third
probably a good
whereas?
example of at least where news reports are suggesting that the experts, the scientific experts who are typically involved in making those vaccine decisions were not consulted.
And diseases that were almost eradicated are starting to pop up again.
I know, we could go on and on just about that one topic.
Okay.
So do you want to stop here or put in something?
No, I'm okay. I guess
No,
I'm okay with this.
Sam, you want to just question or comment?
Just update that draft number 72.
I think it covers a whole host of things that we're concerned about in this room.
So I think my only question for you then becomes who is it offered by? Is it offered by this committee? Is it offered by individuals?
I think Larry said he would sign on to it.
I think you should have him read it first, because when you presented it to him, 30 minutes ago or whatever, you said it was related more to work we've been doing in here, but you weren't very specific to exactly what the resolution was.
No, I said it was our health resolution. That's all I said. So we will show it to him. Senator Cummings, I think will be fine. We'll talk with her. But I would like to be on it. I think Senator Gulick has been taking lead on this. She definitely wants to be on it.
So committee or members?
I'd like to have it committee, but we're going to.
My understanding from Bloomer that it can be,
Yes.
Michael, but
Yes.
that it can,
Absolutely can.
that while committees
Right.
don't frequently
The answer is
introduce
absolutely yes.
resolutions, they can, just,
Are you a yes or
you're not
no?
necessarily aware of that.
Okay.
Yes, I agree with much of it, but,
Okay, which part don't you like?
I think it's very broad, especially in the first page, that it's saying that throwing out of the World Health Organization jeopardizes the health and well-being of Vermonters. I don't think that move itself jeopardizes health. I think blowing it up and, dissolving it would probably jeopardize the health of most nations. But us specifically pulling out of it, I don't think affects Vermont.
Okay, can I share with you a thought here? That right now we provide strong support for WHO, and without the support that we have, vaccinations wouldn't be taking place in third world and other countries and other continents and other nations. So without those vaccinations, we will see a proliferation of diseases that will extend beyond borders to the United States. Secondly, right now, if you think about an Ebola outbreak in Congo, and we don't have the the folks who are going through WHO to prevent the spread of Ebola. We've already seen it in the United States, and we squelched it in Atlanta, Georgia, at the center, at one of the CDC center. If that would happen, we would see dire straits in Vermont. So I see the linkage here as really good for
So
public health.
by pulling the United States out of food, crazy acronym, by pulling us out of food, they're not doing those vaccinations anymore in the country.
The United States is not supporting sufficiently for all those things to happen, including having people on the ground doing that work.
Yeah, well, I mean, I'll be honest, I disagree with him pulling us out of there, but I just think the language is very alarmist.
So you're a supporter of what Donald Trump is doing.
No, actually, I just said the exact opposite about 3 seconds ago.
I was just gonna make the point that millions of Americans live overseas, and they are also gonna be caught in the crosshairs of all of this. And like it says in our resolution, diseases don't have international boundaries.
We can give you an example of that.
Yeah.
When we were living in Turkey, there was a cholera outbreak, and the only way that we survived was by going to a sponsored place to get a cholera shot, vaccination. Or about that, probably saved our lives. Anyway,
I mean, you just.
yeah, we could do, we'll get Ann to support us, or unless you just want to do the two of us. I'm fine. We'll get Ann. I'll ask Ann if she'd like to, and I'll ask Senator, are you gonna ask Ann?
Sure.
Or we'll both
Sure.
ask. That's good.
What's the process from here?
We do a sign up sheet. Like,
So I mean, is today not the last day of session? Is today the last day?
Probably.
Sorry.
It is the last day of
Okay.
session. We can pending notice, pending it on notice on calendar, it can be taken up for immediate consideration. But just a matter of having that request, and I can put that request into
Okay, great. Do we know where Ann is?
probably in.
conference would be-
A conference in Fort
Conference.
So maybe we should just do the two of us so that we can get it.
I'm fine with that. I understand your point.
Also, I disagree with the majority of the cuts that I've seen him make, but I can't say for certain that cutting those 20,000 employees is gonna harm things. I don't know what their job descriptions were. I don't know what they were doing to the CDC. Like, I know nothing about what those exact cuts, so I don't want to put my name without knowing more.
Okay, we've heard enough. We're good.
And sending a final to Linda to post, since you just talked about it.
You can put me on if you want.
I didn't hear what you said.
Oh, I said I just sent this to Linda.
It's on your webpage.
Well, I sent
Oh, the
this
new one.
The
updated
new
one,
one? Okay. And
but if you're adding,
Sure, I'd be happy to.
all right, let me get you on. Do a sign up sheet.
You don't have to. What you can do is, what you would, if you don't do a sign up sheet, then what you should have is an email from Senator Lyons saying that Senator Lyons and Senator Buell are sponsoring
Right.
it. So you'll have it for fun.
First.
yeah, I'll put her first. She's been working on it.
Yeah.
a month. And if there is a sign out sheet, that'll help, I think, process.
Do you think so, or do you wanna?
I can send a note. Who do I send a note to? John?
Just to, in terms of getting it up onto the calendar, then you need to speak to John.
Right, here.
Stan, is it safe draft number?
No, it's 4.1. Okay, so I just emailed it to both of you, so if you, one of you wants to forward it to, let's say, John and Melissa.
Okay, got it. Thanks, Chairman.
Thank you. Tanya, why don't you come up at the table and we'll have you and Michael up here together, and that way we could go through it a little fast.
Senator, why don't you take that seat? I'll pull up one of these.
I would like to see.
Would you like to? Oh,
If you have a chance to sign.
oh,
No, you're good.
of course.
In the middle.
Good, give us a little smile. Okay, so we're looking at the autism Yesterday on the floor, I made a mistake of saying Alzheimer's.
Did you?
We're looking.
They're a little different.
Although Michael Cherny, but.
I said
for the record,
my
I made
memory
that
got-
mistake.
But then they're talking about speech and it's like open scripts.
So why don't we just go through, Linda,
However
can
you
you-
want, Senator.
I was thinking if Linda could put it up on the screen, sure, can you do that?
Do you have it?
And we have it on our web, oh, we
Yeah, I
have,
have a paper copy.
oh, we have paper copies, we're good.
Senator,
So-
could I, are there pens in that jar, just in,
We're good, yeah.
I got you.
in case I have to scribble anything, that's all.
So we have it in front of us, so why don't you just, do you want to say something?
Senator, do you want to, this is
Sure.
your
Absolutely.
sponsor introduction and you'd like in front of you.
Absolutely. So I was asked by some members of my community who either work with individuals with autism or they themselves have autism to sponsor a resolution reaffirming our commitment to protecting individuals who have autism's private health data. There were some statements made at the federal level about creating a registry that's been walked back a little bit, but people are really afraid about how that might be used. And so what this is really an affirmation that autism is a neurodivergence, not a disease, and that the members of our community who are neurodivergent are wonderful assets to our communities and Vermont, and that we have a commitment to protecting to the extent we can. You know, certainly there's a lot of challenging spaces right now where as states we're trying to protect people and that runs into federal law. But this is really a reaffirmation of our commitment to following HIPAA, to protecting people's private information to the extent possible. There was an executive order issued by the governor of Illinois that did a similar affirmation, and this really follows along with that same just support and protection of the members of our community who offer value and just add to the wonderful fabric of our communities. And that's really what this is for.
Good. Thank you.
I've heard from a few people already who are so incredibly heartened to see that 29 senators signed on to supporting protecting them, and they're really feeling seen and heard in a time where there's a lot of fear.
Mhm.
Senator, before I go to a line by line, just to early in the drafting process, I had asked Senator Vyhowski, should I include a clause requesting a Vermont executive order? And Senator Vyhowski indicated in the negative, this does not request any Vermont executive order. It just requests and urges the state to follow certain principles and policies that it has been all along anyway, as well as the feds. If you'd like, I can do a line by, I can do a.
Just, yeah, let's go through it.
Yeah, I'm happy to do so. As you said, this is authored by 29 representatives, and the title is, it's a Senate resolution. Remember, this is a Senate only resolution. Given I asked, similar resolutions already passed in the House. I had asked Senator Vyhowski right from the top, given how late we are in the session, should this be a Senate only? And she said, yes, that would be the better procedural way to go. So that's why it's set up as a Senate only resolution. So it's a Senate resolution urging that all state agencies, departments, and offices protect the civil rights, medical confidentiality, and all aspects of personal privacy of Vermonters who have been diagnosed with autism in light of the Secretary of the U.S. Health and Human Services recently announced plans to establish an autism research database and other databases related to autism. Whereas the state of Vermont is fully committed to ensuring the enforcement of the rights of individuals with disabilities and the provision of inclusive services and person-centered centered systems of care. And whereas individuals with autism contribute their talents, perspectives, and problem-solving abilities to strengthen Vermont's workforce, enrich families and communities, and advance innovation, science, technology, the arts, and beyond. And whereas autism is a neurological difference, not a disease or an epidemic, and whereas the rising autism identification rates, which whereas the rising autism identification rates, which trained clinicians and healthcare professionals are documenting, are attributable to improved diagnostic practices, greater awareness of autism, and expanded access to screening tools. And whereas individuals with disabilities, including individuals with autism, are too often stigmatized and underestimated, and public policy should never diminish the diverse strengths and potential of these Vermonters. And whereas the Secretary of the U.S. Department of Health and Human Services, Robert F. Kennedy Jr., has announced plans to establish a federal research database intended to be used to investigate the root causes of autism. And whereas this new database will be a compilation of information derived from individuals' insurance claims, electronic medical records, and wearable devices such as smartwatches. And whereas although this new database is no longer characterized as an autism registry, as Secretary Kennedy and National Institutes of Health Director Dr. J. Bhattacharya, and I apologize, I'm sure I'm mispronouncing his name, had previously announced, and despite public promises of personal and medical privacy, significant concerns remain regarding the potential use of Vermont's sensitive, personally identifiable healthcare information without their specific and informed consent. And whereas the governor of the state of Illinois has issued Executive Order 2025-02 PEO to ensure that Illinois state officials fully comply with all applicable state and federal legal privacy protections in matters affecting the collection and use of information of persons being tested for who have been diagnosed with autism, or in any database that now or maybe in the future exists that includes personal information related to autism, that the information not be collected unless doing so is strictly necessary for authorized purposes, and that the information not be disclosed outside state government except if one of the conditions listed in the EO is met. And whereas it is important that Vermont officials are similarly vigilant in the protection of personal data being collected for any type of analysis or assessment related to autism. Now therefore be it resolved by the Senate that the Senate of the state of Vermont urges that all state agencies, departments, and offices do everything in their power to protect civil rights, medical confidentiality, and all aspects of personal privacy of Vermonters who have been diagnosed with autism. Be it further resolved that the Secretary of State be directed, Secretary of the Senate rather, be directed to send a copy of this resolution to the U.S. Secretary of Human Services, Health and Human Services, the Director of the National Institute of Health, Vermont Congressional Delegation, Vermont Secretary of Human Services, Vermont Human Rights Commission, and the government.
Go ahead.
Procedural question, are we just looking to straw pull this, or are we looking to make amendments?
The
Or
resolution, we can make an amendment.
Treat it as a bill.
It's a bill.
As a bill, and you can do whatever you decide you want to vote it up, down, and then whatever.
Senator, are you hoping to do this today?
I am hoping to get
Okay,
it done.
We don't need to do anything like that. If we had time, I mean, I'm sure we could do a lot of great things with it, but we don't think we have to. So, sure.
So all those in favor of passing the resolution to the full Senate? Opposed? Our honorary member showing up again. Okay, good. So
Oh, there's one.
procedurally then, I'll report it up on the floor. I won't report it. I'm going to yield to the senator from Chittenden Central to offer comments. Okay with you?
Yes, I would really appreciate it.
All right, we'll do that. So Linda, what do I need to do, get this up to John Gilmer? So I need to have, think about it.
You can have the vote.
And you need to
That's it.
sign.
I'll just take it up with a vote. I can sign this one. Oh, yeah. Can I have
Or
Nan's?
Sam, I sent you
you should.
sign outs.
Yep.
I just want to thank the committee for taking it up and moving it.
You're gonna do that for this one. You're welcome. I'll sign the sheet. What signs the sheet?
No, that's what I was.
Oh, no, I don't need that. I just,
I'm still.
Do I need to focus?
Yeah.
We're treating it as.
yeah,
Yes.
it's draft 1.3.
I'll just count the hands up as yeses. But
And you don't have to respond to them, it's already been introduced.
Okay, ours has not been introduced, so I don't know what to say.
No, you just take it up.
Just take it to.
And I have a copy.
And I'd like to email them and let them know it's coming up. Are you?
Right, but someone needs to
Yeah, I just need a copy.
just
No,
receive.
not the autism one, the health and welfare.
She needs a copy of it.
And on the autism one, one of you will need to bring it up with Senator Lyon's signature on it and the vote.
I got it. I'm taking it up with my name on it and the vote, and I'm gonna grab it in coming, so I
Thanks,
have a
Michael.
copy.
You're very welcome.
All right.
You're very welcome.